Busoga sub-region remains crippled by a drug theft syndicate which steals vital drugs meant for millions of Ugandans in the countryside. These cartels involve medical staff, law enforcement officers, and unscrupulous individuals who cart off these medicines and repackage them for sale to individuals at clinics and smuggle others across porous border points such as Sofia in Busia to Kenya, the DRC, and South Sudan. NTV conducted an investigation in Busoga sub-region and discovered that the medical superintendent of Bujiri General Hospital, Dr. Abubakar Nakendo, is on the run after he was accused of extortion, maladministration, and theft of government stores and selling them at his privately owned Bujiri Medical Services. The Deputy Inspector General of Government, Ms. Anne Twinomugisha Muhairwe, recently directed the Bujiri District Police Commander, Godwin Ochachi, to arrest Dr. Nakendo and have him interdicted with immediate effect. Following several complaints of extortion, maladministration, and theft of government stores against Dr. Nakendo, the medical superintendent of Bujiri General Hospital, we conducted an on-spot inspection at the hospital on December 14, 2023, and found him to be absent. We contacted him on his phone number 039-296-0372 and asked him to report to the facility. He switched off his phone and remained unreachable until the end of the inspection at 11 p.m. The letter reads in part. The letter further reads, the community then guided the inspectorate team to his private clinic at Bujiri Medical Services in Bujiri Town, where we discovered medical supplies belonging to the government, including blood marked Government of Uganda not for sale. The same supplies were not available at the government medical facility, Bujiri General Hospital. Dr. Nakendo declined to comment on the matter when contacted by phone. The executive director of Anti-Corruption Coalition Uganda, Marlon Agaba, told NTV that,
of course, we know that there are complicated syndicates in there. There could be connivance with some of the investigating agencies or even security agencies that facilitate this kind of work to go on, especially where it involves like crossing the border and going to neighboring countries.
Agaba says they work with whistleblowers across the grassroots.
In scenarios where we have monitors in the villages, a monitor goes and monitors a health center and makes a report. And then time comes when they have to go and use the same services and they have to be served by the same people they reported. And we receive scenarios where either they are scared or they have been chased away or there have been dry drugs or they are being castigated for their reports. So it also becomes a challenge in that, yes.
The National Medical Stores, whose mandate is to procure, store, and distribute medicines, recently digitized its drug delivery system. However, Agaba says the process has not been completely digitized and there are loopholes that are exploited by cartels.
I think the process hasn't been completely digitized. That is issue number one, that much as we may have the digitization at the center, at managing the warehouses, when you go along the chain, for example, digitization may not stop the leakages along the chain in terms of what has been dispatched from the stores to the different centers and then to the facilities. That may not stop that, but also we're looking at digitization not working at the facilities. For instance, the facilities are using manual systems, they're using paper for the distribution of drugs.
The 2021 Inspector General of Government report indicates that the theft of medicines and equipment is the commonest form of corruption in the health sector. The IGG says that as a result of theft of government drugs, this places patients' lives in harm's way. Patients are frequently forced to purchase medicines on the black market despite the fact that they are entitled to receive them free of charge. This can potentially lead to negative health outcomes as patients may buy substandard or falsified medicines or may not be able to afford to access medicines at all, IGG states in the 2021 report. Although the infrastructure at many government hospitals has been given a facelift, service delivery remains in a sorry state as there are few medical personnel to attend to patients and barely any drugs for the poor masses in the countryside. The National Drug Authority recently revealed that Busoga sub-region has the highest level of drug hawking and sale of counterfeit drugs in makeshift markets. The NDA spokesperson, Abiaz Ramwiri, says the problem is prevalent.
I will give you an example of the raid we had in Kitugum, where we got drugs and equipment worth over 2 billion Uganda shillings. That case of a government worker, a hospital worker who was working in stores, the same people from the same Kitugum district are the ones who have been putting pressure on both National Drug Authority and the judiciary to release their son and also release the drugs.
The resident district commissioner, Paul Mwidu Kalikwani, said the investigation by the IGG was ongoing in the district.
We had the deputy IGG herself here in the district, and her coming is related to service delivery in health. There are two issues for investigation. One, lack of academic qualifications by some of the health workers. Number two is absenteeism by health workers. And number three is the shortage of essential or generally drugs in our health facilities.
The Busoga North Regional Police spokesperson, Mr. Michael Kasanda, said they recently conducted a joint operation with health officials over theft of drugs in the area. For instance, earlier on this year, police arrested the in charge of Kasolwe Health Center 2 in Kagumba Sub-County, Kamuli District, and a security guard over theft of drugs. The health officials at the facility reported that some people broke into the facility and took the drugs.
And we suspected there was some connivance, and therefore we took action and ended up arresting some health workers and other staff, especially the guards, to explain what exactly happened.
Police filed charges of theft and burglary against the suspects. Kira Regional Police spokesperson Mr. James Mubi said an operation targeting drug outlets, stealing government drugs, expired drugs, and unqualified personnel was conducted in September this year in Busoga.
Some of these outlets, they sell even government-labeled supplies, which are not for sale. You see, that is another critical point. So what does it indicate? It indicates there is that syndicate with some health workers operating certain health centers, government health facilities, who smuggle these drugs.
He said about a total of 166 illegal drug outlets were closed by officials from the National Drug Authority, and drugs worth millions of shillings were confiscated. The NDA head of enforcement, Samuel Tomukama, said 241 boxes of assorted medicines worth 80 million shillings were recently impounded in the sub-region. In 2006, Mr. Museveni directed health ministry officials to label government-owned drugs, but we discovered that these cartels are using a chemical which eradicates the not-for-sale statement inscribed on the packages. Acting on a tip from a whistleblower last week, we camped at Nabitambala village, Busede sub-county, a rural area in Jinja district where a suspect was allegedly running a clinic selling government drugs. But by the time the NDA officials raided the area, the suspect had already been tipped off and concealed the stolen drugs. In 2018, police in Namayingo district arrested the in-charge Buyombo Health Center 2, George Omodo, in Namayingo district for allegedly stealing drugs meant for the facility. The suspect is said to have been found with 660 doses of Cortem, a drug used to treat malaria. In 2019, police in Bujiri district arrested the Bujiri hospital pharmacist Aisha Chitimbo over allegations of drug theft. It is alleged that the two connived to steal 11 tins of anti-malarial drugs and 136 blood pressure drugs known as artovastine.